Hello and welcome to Rise and Unwind Orlando. We're that show where we talk to experts from across the country about things you could do right here in your neighborhood. And on this week's show, we got this.
This is a group of men that are also at high risk of developing prostate cancer. So it's those three groups we focus on in particular.
I would say the easiest really is if we have an opportunity to get up and be active, let's do that.
The biggest effect, besides just the trauma of the surgery, was that I lost my voice. I was down to a pure whisper.
I think it's really important for everybody to take a step back and review the current plan that they're on. And even if you really like the plan you're currently on, there can be changes year over year. So make sure you understand the changes.
And what I love most about the GrandmaCore trend is there's this element of community.
We've got great deals too on grocery items like whole carrots, grocery gold potatoes, and of course, cut green beans.
All of that and more right here in Rise and Unwind. Nearly half of adults in the United States have high blood pressure, and many don't even know it. The American Heart Association and the American College of Cardiology just released a new high blood pressure guideline offering important updates for everyone, especially women. Joining us today is Dr. Rachel M. Bond, an American Heart Association volunteer expert, to share what women need to know at every stage of life. Welcome to the show, Dr. Bond. How are you?
I'm wonderful. Thank you for having me.
The American Heart Association recently released a new high blood pressure guideline. What do people need to know about it?
Yes, so the American Heart Association and the American College of Cardiology did release a new blood pressure guideline. Things that have not changed are how we define high blood pressure. First step is understanding what's normal blood pressure. So normal blood pressure is usually anything less than 120/80. Anything above that is elevated up until we get to the first stage of high blood pressure. Those are numbers above 130/80. And then the second stage, that's usually above 140/90. The higher our blood pressure is, the higher our risk of heart disease. And why this is so critical, it's unfortunate that when it comes to high blood pressure, a lot of times there are no warning signs. There's no signs and symptoms. It's very silent. So the only way for you to understand if you have elevated blood pressure or high blood pressure is to go to the doctor and get your blood pressure checked on a regular basis.
And let's talk about blood pressure and pregnancy. What should women know during that stage of life?
One thing that the guidelines wanted to highlight was that there are different stages in a woman's life that can actually impact their blood pressure and their overall cardiovascular health. One of those stages is during pregnancy. Pregnancy, for all intents and purposes, is a female's first stress test. With the hormonal changes, a lot of times that could negatively impact their blood pressure. And if you are a patient that during your pregnancy develops high blood pressure, you're at about a 2 to 4 times greater risk of having high blood pressure outside of the pregnancy, and a 2 to 4 greater risk of having cardiovascular disease outside of the pregnancy. A lot of times that could occur up to several decades after the delivery. So having those conversations with your physician and healthcare professional about your pregnancy risks as well as your more traditional risk factors can really help in the management strategies.
And what actions can women take to help minimize the risks?
So there are several. The first one is being active. We know that the American Heart Association recommends at least 150 minutes per week of some form of moderate exercise. That can include walking at a very brisk pace. They also recommend eating very clean and healthy food, limiting saturated fat, processed foods, foods that are rich in salt or sodium, and replacing that with things like healthy fats such as olives and olive oil, and also whole grain. They also talk quite a bit about sleep. When we think about sleep, we need to ensure we're getting at least 6 to 8 hours of sleep per night. And the last thing that's so important is making sure that we're getting our numbers regularly checked. Blood pressure, cholesterol, our blood sugar, and we're also addressing with our physician what our weight is and if our weight is appropriate for our height.
So what are some simple steps anyone can start taking today to help better manage their blood pressure?
There are so many easy steps, many of which I had already listed, but I would say the easiest really is if we have an opportunity to get up and be active, let's do that. As I mentioned, that moderate exercise includes walking, so maybe using the stairs at work. If we're using public transportation, getting off at a stop a little earlier than where we normally do to encourage ourselves to get those steps in. And something also very simple is just making those minor adjustments to our nutrition as well as our overall lifestyle.
And Dr. Bond, where can our viewers go for more information?
So the American Heart Association has several websites. One of them is heart.org, and the other one is goredforwomen.org. /high blood pressure. And that's really going to hone in on high blood pressure both during pregnancy and outside of pregnancy as it pertains to women's cardiovascular health.
I want to thank you for joining me this morning.
Thank you so much.
Imagine needing surgery after surgery just to breathe or speak. That's the life for people living with a rare HPV-related disease called Recurrent Respiratory Papillomatosis, or RRP. Now, for the first time ever, the FDA has approved a non-surgical treatment that's changing lives. Joining us today are Dr. Simon Best from Johns Hopkins School of Medicine and Michael States, who took part in the clinical trial. Welcome, both of you.
Thank you for having us.
So, Dr. Best, for people hearing about this for the first time, what exactly is RRP and how does it affect patients?
Well, thank you so much for having us here. And we're really excited on behalf of Precigen to be able to talk about recurrent respiratory papillomatosis, or RRP, as you said. Indeed, RRP is an HPV-associated disease of the vocal cords and airway. It's caused by types 6 and 11. And it's characterized by recurrent papillomas that grow on the vocal cords and thus affect our voice and our breathing. Historically, surgery was the only way to treat this problem. We would take patients to the operating room, remove the papillomas, only for it inevitably to recur. So patients would be in a never-ending cycle of surgery after surgery after surgery.
Michael, can you share your personal experience living with RRP and how it's impacted your life?
Yes. Through the course of my RRP, I've endured over 50 surgeries. I've sort of lost count after a while. The surgeries would provide temporary relief, much like Dr. Best mentioned. Having surgery, knowing I will be having another surgery, it's not going to cure it. The biggest effect, besides just the trauma of the surgery, was that I lost my voice. I was down to a pure whisper. That affected me at work. I wasn't able to communicate well with my patients. I'm a dentist by trade. I wasn't able to communicate in social situations with friends and family. And ultimately, I just became a recluse, trying to avoid any sort of social or professional interaction.
Well, I'm glad you got your voice back, Michael, because it's great to hear your story. Dr. Best, how does the new treatment work compared with the repeated surgeries that used to be the only option?
Well, most patients who get HPV, because HPV is actually quite common, their immune system is able to recognize it and eliminate the infection. But for patients with RRP, their immune system has not done that. So Papzimeos is approved for adults with RRP, and it's an immunotherapy that's directing the immune system against the HPV virus. So it's actually addressing the underlying problem and allowing the body to eliminate that chronic infection and thus break the cycle of repeated surgeries.
Michael, what has it meant to you to be a part of this clinical trial and to see this new treatment approved?
Well, on a personal level, I have not had surgery since I was in the trial, 2.5 years now, which is amazing. My voice is back, as you mentioned earlier. And the side effect of the shot, which is much like getting a flu shot or a COVID shot, is so much better than having surgery repeatedly, every few months. If on another level, I'm also very proud to have been involved in the trial, participating in my way to advance the science and will help thousands of people who suffer from RRP.
Dr. Best, for those who want to learn more about RRP or this breakthrough therapy, where should they go?
There's a lot of information about RRP and HPV-associated diseases and the new treatment Papzimeos on the Precigen website, precigen.com.
I want to thank you both for your time and for being here.
Thank you.
Thank you so much.
Caring for a loved one with prostate cancer can be an emotional journey, and many caregivers play a much bigger role than most people realize. A new survey found that over 75% of caregivers actually encourage their loved ones' first screening. Joining us today to talk about the critical role of caregivers and new advances in prostate cancer treatment are Dr. Daniel George from Duke University and Gina Carithers, President and CEO of the Prostate Cancer Foundation. Welcome to you both.
Thanks, Chris. Happy to be here.
Thanks, Chris.
Dr. George, can you tell us about prostate cancer and which men are at the greatest risk of being affected?
Yeah, Chris, the truth is all men are at risk for developing prostate cancer over their lifetime, but particularly three groups. Men with a family history, particularly a direct relative like a father or brother, are at increased risk of developing prostate cancer. In addition, men who identify as Black or African ancestry, these are men that also have a greater risk of prostate cancer and aggressive forms of prostate cancer. And then finally, we recommend a PSA, a blood test in men at midlife, usually between age 45 and 50. It can be drawn by your primary care doctor. And if this level is above 1.6, this is a group of men that are also at high risk of developing prostate cancer. So it's those three groups we focus on in particular.
Gina, what are some ways caregivers can support their loved ones during their prostate cancer journey?
So, Chris, one of the key things is that the caregiver or the support mechanism for the male involved can be encouraging screening and early diagnosis. So from the time they have their mid-level PSA taken, it's important that they get an annual blood test. It's a simple blood test, and that is the first measure of prostate cancer. So screening is a critical, important piece to this because early diagnosis leads to 99% of men being cured. And then if the patient already is diagnosed with prostate cancer and develops an advanced form of this disease, a form where it's left the prostate itself and may be found in the bones or other tissue away from the prostate, for those men, seeing the doctor, having the caregiver or the loved one go to the doctor's appointments, sharing that information, being engaged in gaining the knowledge about this disease and the treatments, nutrition, exercise, and all of the things that support that patient through healthy, everyday living.
Dr. George, how is the prostate cancer treatment landscape evolving today?
Chris, we've made tremendous progress in the last 10 years. I don't know the public's fully aware of how much this has changed. 10 years ago, men with advanced prostate cancer had spread to their bones or other organs, had an average survival of 2 to 3 years. Our latest data shows with newer combination therapies now, men are living 7 to 10 years or more in some cases. So it's a chronic disease, even in the worst case scenarios. But all the more important for these men now to lean into those survivorship issues, the things that can help them live a good quality of life during this time. And they absolutely can, but they need to invest in some lifestyle changes. That support with caregivers is so critical. It's a differentiator in those men who really do well living long-term with prostate cancer. So I can't stress enough how important that is. And for advances in prostate cancer, if you want to learn more about this, we have a new website called advancedpctreatment.com. And I would encourage you and patients to check this out.
Gina, what resources are available to help patients and caregivers feel more supported?
So at the Prostate Cancer Foundation, we've recently launched a new website that provides education from screening, diagnosis, and all the elements of diagnosis through advanced care of this disease, as well as webinars and online resources. That's available at pcf.org.
Dr. George, one more time, where can our viewers go to learn more?
Yeah, Chris, if viewers want more information, and the best source we have today, our newest website is called advancedpctreatment, all one word, .com. And it has all the latest in these advanced treatments as well as information for caregivers.
I want to thank you both so much for being here and letting us know all this important information.
Our pleasure.
Thanks, Chris.
Health coverage is something we don't think about until we really need it. And for millions of Americans on Medicare, this time of year is when the big decisions get made. Joining us is Jeremy Gaskill, Regional Medicare President with Humana. to help us understand what the annual enrollment period means and how Medicare Advantage plans can support better, more proactive care. Welcome, Jeremy.
Good morning. Thanks for having me.
Why is this such an important time of year for people who are eligible for Medicare?
Yeah, right now the annual enrollment period is occurring, and that began on October 15th and it runs until December 7th. And this is the time when the beneficiaries can review their plan, they can make changes to their plan, they can enroll in a Medicare Advantage plan. It's also the time of year when they can enroll in a prescription drug plan also. And all of this takes effect January 1st, 2026.
So explain to me real quick the difference between Medicare Advantage and Original Medicare. Can you break down the main differences between the two?
Yeah, great question. Original Medicare is a federally managed health plan, and this covers your hospital stays and your doctor visits. There is a deductible associated with this, and ultimately a member would be responsible for about 20% of the cost. It is important to point out that if you want to have prescription drug coverage, you have to purchase a separate prescription drug plan. Now, Medicare Advantage plans are administered by private insurers like Humana. And in addition to your hospital stays, your emergency room stays, your doctor visits, there could be additional coverage for additional benefits. It just depends on where you live. I think one of the most important things with Medicare Advantage is that there is an out-of-pocket maximum. So you always know what is the most you could spend in a given year.
That's really helpful. When choosing a Medicare Advantage plan, what should people really consider to find the best fit for their needs?
Yeah, I would say cost and coverage. I think it's really important for everybody to take a step back and review the current plan that they're on. And even if you really like the plan you're currently on, there can be changes year over year. So make sure you understand the changes. When it comes to cost, review your healthcare expenses from the prior year. Think about your budget. Think about your health needs in the coming year. And when you're comparing plans, look at premiums, look at copays and out-of-pocket maxes to ensure that you're picking the right plan for you. And when it comes to coverage, remember, Medicare Advantage plans have networks. So make sure your doctor and your preferred hospital is in network. And if you're looking at a plan with a prescription drug benefit, make a list of your medications, ensure they're covered, and make sure you understand if there's additional costs associated with any of them.
How do these Medicare Advantage plans encourage things like preventive care and regular checkups?
Yeah, Medicare Advantage plans really emphasize preventive care and care coordination. These plans can include coverage for your annual routine visits, your annual screenings, your management of chronic conditions. This all helps you stay healthy and ensures early detection, which ultimately just leads to better outcomes. And so when you're comparing plans, make sure you understand what is covered with preventive care, with annual screenings, and make sure you understand if there's any additional costs associated.
For anyone who needs a little help comparing plans or signing up, where can they turn for guidance?
Yeah, you know, Medicare.gov is a great place to start. They have a really neat tool where you can compare plans side by side. There's also a number of professional licensed sales agents that you can engage with, and they'll sit down with you and help you pick the plan that's right for you. And if you're interested in information specific to Humana, Humana.com.
One more time, where can viewers go to get more information about Humana?
Yeah, Humana.com is a great resource to understand and see the plans that we're offering in your area.
Excellent. Thank you so much for joining us today.
Thanks for having me.
I actually grew up around a sewing machine. My mom's a seamstress, so I learned early on how much heart and patience goes into making something by hand. And now it feels like the rest of the world is catching on again. The hashtag GrandmaCore trend and the comeback of crafting are reminding people that slowing down and creating can be good for the soul. So joining us is Megan Murphy, author of Your Fully Charged Life and lifestyle expert, to talk about this creative revival, and Michael's new knit and sew shop. Welcome to the show, Megan. How are you?
Yay, thank you for having me.
Crafting has been around forever, but it feels like it's really making a comeback. What's driving this return to the handmade creativity?
So I love this. We are really seeing that creativity is the new self-care. And Michael did a 2025 creativity trend report, and people reported they were doing emotional support crafting. So they're really turning to things like knitting and sewing and crocheting as a form of therapy and self-care. And you get it because you're doing those repetitive motions. You sort of get into that flow state. It's almost like deep breathing or meditation. It really kind of just melts away that stress.
Michael's just launched its new knit and sew shop chain-wide. What makes this such a special experience for shoppers?
So the big news here is that Michael's acquired the best of Joann. So the things that we loved about Joann are all now at Michael's. Those proprietary Joann brands like Big Twist, now at Michael's. There's 25% more yarn. There's 125,000 fabric options online at michaels.com. 650 of the stores rolled out cut bars, so they're dedicated tables for cutting fabrics. You're going to see brands now like Singer and Brother and Gutermann. A lot of what you loved at Joann is now at Michael's.
And the hashtag GrandmaCore trend is blowing up online. Why do you think people are drawn to that cozy, nostalgic vibe right now?
So I love this. I mean, I think it's an antidote to digital burnout, right? Instead of doom scrolling, younger generations are knitting, and they're picking up those so-called grandma crafts like embroidery and felting and crochet, and just really like wanting those simpler times. And what I love most about the GrandmaCore trend is there's this element of community. So in the Michael's Trend Report, they found that people are doing DIY and dine parties. So they're getting together in person, offline, and doing these projects and sharing a meal. So they're knitting and sewing and sharing a meal. And I just love that community aspect of the trend.
For folks getting ready for the holidays, what are a few handmade gifts anyone can make, even if they're just starting out?
Sure. Well, nothing says I love you like a handmade gift. A friend of mine embroidered and did the patchwork on my sweater, and I just treasure it. I am working on needlepoint. I am fully charging a tea towel with a lightning bolt from my mom. And Michael's also has these great kits. So the kits have all the supplies you need to do a project, all in one kit, $12. And look how cute these little unicorns. They've got felting and needlepoint, all these different projects, everything you need with the how-to in the kit. You can also go to michaels.com/projects for more information, how-tos, and really links to all the supplies you need to do these projects.
And where could our viewers go to learn more or even find inspiration for their next project?
So you can go to your local Michael's store, which I like to do, or you can go to michaels.com or michaels.com/projects.
Megan Murphy, you're one of our favorites. Thanks for being here today.
Thanks for having me.
Ever feel like hosting Thanksgiving turns into a marathon instead of a meal? Between shopping, prepping, and trying not to burn the rolls, it can get overwhelming fast. Joining us today is Amazon spokesperson Griffin Buck, here to help us enjoy the holiday without the stress. Welcome, Griffin.
Good morning, and thank you so much for having me. That's right, Thanksgiving and the busy holiday season are right around the corner, and we're here to make meal prep both affordable and convenient for everyone.
Griffin, what's your advice for keeping our Thanksgiving budget under control this year?
Customers can feed 5 for just $25 when they shop Amazon's Thanksgiving meal deal from November 12th through November 27th. It's one of the best deals around. The meal includes all the essentials like a butterball turkey for just 69 cents per pound, pre-made sides like home-style stuffing and mashed potatoes, and traditional fixings like gravy, green bean casserole, cranberry relish, crescent rolls as you mentioned, and of course a holiday pie to wrap it all up. And we know that many folks will be traveling for the holidays, which is why the savings go beyond the kitchen. Every Friday through the end of the year, Prime members save 25 cents per gallon when they fuel up at participating BP, Amoco, and AMPM locations nationwide. That's more than double the everyday Prime fuel savings, just as millions get ready to hit the road for the busy Thanksgiving travel season.
Wow, that's a great deal. Now a lot of us are trying to save time. How can we make meal prep feel more like work smarter, not harder?
Absolutely. Shop strategically. Take advantage of pre-made items that deliver convenience and value without sacrificing quality, like our home-style stuffing or mashed potatoes that don't require multiple cooking appliances or endless extra hours in the kitchen. But if you do prefer to make your own homemade recipes from scratch, we've got great deals too on grocery items like whole carrots, grocery gold potatoes, and of course, cut green beans.
Griffin, what are some of your favorite tips for keeping the holiday kitchen stress-free?
Keep the stress levels low and your oven free by starting with a no-cook appetizer. Like right over here, we've got our charcuterie board. It's really easy to assemble a delicious appetizer spread that requires zero cooking. This board is made with premium meats, cheeses, a variety of store-bought dips, and elevated with fresh herbs so your guests have a delicious appetizer to enjoy without having to, well, you're just in the kitchen. You can spend your time in the kitchen focused on your main items without having to stress about cooking appetizers. Now, another thing to remember is the dessert. There's so many different flavors, and it's hard to choose just one. We've got a variety of pies for less than $7, including pumpkin, pecan, sweet potato, apple, berry, and cherry. And if you want to elevate your pie table a little bit, maybe throw in some fun toppings as well. Ice cream and whipped cream, those are classics, but why not spruce up your dessert table with maybe some hazelnut spread on top of your pumpkin pie, or maybe some chocolate sauce right on top of your pecan pie. My personal favorite is a little bit of salted caramel drizzled over my apple pie. It's a great way to get everyone excited about dessert.
As if anyone needs reason to be excited for dessert, right?
Exactly.
But everyone, myself included, forgets something at the last minute. What's the best way to avoid those extra store runs on Thanksgiving Day?
Get ahead of the holiday rush. The holidays are about spending time with your family and friends and not stressing about last-minute grocery shopping. There's nothing more convenient than getting your groceries delivered straight to your door. Whether it's with Amazon Fresh Online or Whole Foods Market, you can focus on making the Thanksgiving meal, enjoying time with your friends and family, and get back to the day. It's also important to delegate and share. There's no reason that you have to do every single thing yourself. You can ask your friends and family to bring their favorite appetizers, sides, or maybe dessert items. You can focus on cooking the turkey and finally enjoy your own party.
Finally, where can our viewers start planning their own stress-free feast this year?
Viewers who are looking to start building their Thanksgiving baskets can go to amazon.com/grocery to explore our wide selection and everyday low prices. Get back to spending time with your family, enjoy a delicious Thanksgiving meal, and make it simple and stress-free.
Griffin, thank you so much for joining us today and making us all super hungry.
Thank you so much for having me.
That's it for Rise Unwind. I want to thank you for tuning in and checking out the show. If you actually want to be on the show, go to our website. That's riseunwindtv.com. Fill out the form, send it on in, and maybe you could be on a future episode. We also are on social media. We're on Facebook, we're on Instagram, plus we have a YouTube channel. All of those can be found at Rise Unwind. Make sure you like, you comment, you share, subscribe, click the bell button. All the stuff that YouTubers say helps us out too. And until next week, that was Rise Unwind.